Hello, welcome to ANA community. In the past video, we have discussed electrocardiogram, its indications and contraindications. So, from the coming video onwards, we are going to discuss the simpler informations which are easy to understand will be dealt first, and little bit complicated informations we are going to deal later. Initially, we are going to discuss about the electrocardiographic paper as well as regarding the normal ECG form. That means what it contains, we are going to discuss in the present video. When you think about ECG paper is concerned, it is nothing but a graph paper having the one small square of either 1 centimeter width and height and one large square having the width and height of 5 mm. When you think about the x-axis, that represents the time parameter. And when you think about the y-axis, that represents the voltage parameter. As far as the speed of the electrocardiograph is concerned, it is 25 millimeter per second. When you look into that, so the one small square in x-axis that represents 0.04 second, and one large square represents 0.2 seconds. Whereas the one small square in y-axis represents 0.1 millivolt, whereas one large square in y-axis represents 0.5 millivolt. When you think about the calibration, this is nothing but the standardization of the electrocardiogram as such. Normally, the height as such, it will be of 1 centimeter height. Sometimes 2 centimeter height may be used, sometimes half centimeter height can also be used. But the standardized one, whatever the calculations are being made based on the electrocardiogram readings, that will be based on 1 centimeter height calibration. So that means it will be having the 2 large square. And any of the deflection which is present, this is considered to be the isoelectric line. That means where there is no deflection at all, that is considered to be isoelectric line, or otherwise termed as zero potential line. If the deflection or the deviation of this isoelectric line above that isoelectric line, if it is being present, that is being termed as positive deflection or otherwise upward deflection. But that is more commonly said as positive deflection. And if the deflection is present in the below the isoelectric line or downward deflection, that is termed as negative deflection. And when there is no upward and downward deflection that is being present, that is being termed as isoelectric line or zero potential line. So here, this is considered to be isoelectric line, and this is considered to be upward deflection or positive deflection, and this is considered to be negative deflection. Here, this is also considered to be positive deflection, and this is also positive deflection. When you think about the normal ECG, it contains waves, it contains intervals, it contains segments, and it contains J point. So waves are P wave, QRS complex, T wave, and sometimes U wave. Whereas intervals, PR interval, QRS interval, QT interval, PP interval, and RR interval. And segments are PR segment, ST segment, TP segment or TP line, and J point is nothing but the junction present between S wave and ST segment. So these are the normal components of electrocardiogram. Now we are going to define one by one what these different terminologies are. When you think about P wave, it is considered to be the first deflection present in the electrocardiogram. Normal P wave, it is having the measurement of less than 2.5 mm in x-axis as well as in y-axis. It has two components, proximal component and distal component. Proximal half component, distal half component, wherein the proximal half component represents right atrial activity, whereas the distal half is representing the left atrial activity. The whole P wave, that is termed as atrial depolarization. It's a special note. Atrial depolarization is not equal to atrial systole. Atrial depolarization, this will be followed by atrial systole. And ventricular depolarization, this will be followed by ventricular systole. So this is what is considered to be the P wave. It is the first and foremost deflection of the electrocardiogram. It represents atrial depolarization. When you think about the QRS complex, it is nothing but the group of different deflections which are seen at a particular time. So here the first negative deflection, that is being termed as Q wave. That is first negative deflection in the QRS complex is being termed as Q wave. First positive deflection in the QRS complex represents R wave. And first negative deflection following the positive deflection is termed as S wave. Here the Q wave, this is actually representing the septal depolarization, whereas R wave represents the activity, that is the depolarization activity, which is spreading from endocardium to epicardium, whereas S wave, that represents the depolarization of posterior wall of the heart. Altogether, the QRS complex represents ventricular depolarization. So it need not be QRS complex is considered to be the Q wave, R wave and S wave, that need not be present in all the leads. These are the different patterns that you are going to observe in the different leads as such. QR pattern, QS complex, QRS, QRS. So here Q and R are the capital waves, Q small, R capital and S small, Q capital and R small wave, R capital and S wave, R small and S capital wave, RS and R dash wave, RS R dash wave, RS and R dash wave. So here the any deflection that is present less than 5 mm, that is usually written in small letters, and any deflection which is present more than 5 mm height or depth, then they are written in capital letters. So here the last three deflections, they are a little bit different when you look into the routine pattern as such. RS R dash pattern as such. So this particular RS R dash means what? So R means the first positive deflection in the QRS complex. S means the first negative deflection following the positive deflection. And R dash wave refers to the second positive deflection in the QRS complex. That is R dash wave. Whereas there is one more pattern, that is S dash wave. That is the second negative deflection following the second positive deflection, that is termed as S dash wave. So these are the different QRS complexes that you are going to observe in the routine electrocardiogram. This is termed as T wave. This is nothing but representing the ventricular repolarization. This is usually be present in the same direction of QRS complex. That means if the QRS complex is positive, T wave will be positive. If the QRS complex is negative, the T wave will be negative. But this is different from P wave, wherein the P wave is usually having the symmetrical limbs, whereas T wave that will not be having the symmetrical limbs, they will be having the asymmetrical limbs. So that means one limb will be comparatively longer than the other limb. This is the typical nature of a T wave. This is what is termed as TA wave. Normally, this particular TA wave will not be observed in the routine electrocardiogram. The reason is, whenever there is atrial repolarization, that will be associated simultaneously with ventricular depolarization. Hence, we are not going to get the TA wave routinely. This may be observed when the person is doing any kind of the strenuous exercises as such. When you see this particular small picture, that is showing the TA wave. In the extreme left, it is the image, whereas in the extreme right, how this particular TA wave can be seen. It will be looking like a perfect curve itself. When you see this particular wave is little bit downwards, and when you see this particular wave, this is upwards. When you join these two, it represents the same way as it is a perfect curve can be seen. This is what is termed as TA wave, and this is actually being considered to be atrial repolarization wave. To sum up, the P wave represents atrial depolarization wave, whereas QRS complex represents ventricular depolarization wave. T wave represents ventricular repolarization wave, whereas U wave, they are normally not visible. If at all they are being visible, they are going to be visible in the chest leads, which we are going to learn in the coming days. So this is what is considered to be the P wave, QRS complex, and T wave. Here, P wave, that is atrial depolarization, this will be followed by atrial systole, and QRS complex, that is ventricular depolarization wave, this is followed by ventricular systole, and T wave, that is representing the ventricular repolarization, this will be followed by ventricular diastole. Now, we are going to look into the different intervals. So when you think about the PR interval, this will be defined as the time duration between the onset of P wave till the beginning of QRS complex. Normal PR interval will be up to 3 to 5 small squares. One small square represents 0.04 second. So that means 3 to 5 small squares. That means the PR interval will be up to 0.1 to 0.2 seconds. Normally, it will be less than 3 small squares, specifically seen in case of infants. If it is in the elderly people, that may represent nodal rhythm. So when you think about PR interval, this actually represents the time taken by the sinus impulse to reach from sinoatrial node to AV node through atria. This may vary with heart rate. That means the more the heart rate, the person will be having lesser PR interval. When you think about the QRS complex, it is nothing but the time duration, that means in x-axis, from the beginning of the Q wave till the end of the S wave. Normal QRS interval is up to 3 small squares. That means up to 0.12 seconds. This actually represents the time taken for the movement of the depolarization wave of septum and ventricles to reach from endocardial surface to epicardial surface. When you think about the QT interval, it is nothing but the time duration in x-axis from the beginning of the Q wave till the end of the T wave. The normal QT interval will be up to 11 small squares. That means which may range from 9 to 11 small squares. That means 0.36 to 0.44 second. Actually, this is actually representing the total activity of ventricles. That means total activity in the sense both depolarization as well as repolarization. That means total ventricular systole as well as ventricular diastole. That means total ventricular activity that is considered to be QT interval. When you think about the QU interval, it is normally not seen usually. If at all that is being seen, they are seen in V3 and V5. That represents the total time duration between the beginning of the Q wave till the end of the U wave. U wave will be observed after T wave but before P wave. It has no clinical significance except in cases of hypokalemia. Hypokalemia refers to the concentration of the potassium ions are less in the blood. It is hypokalemia. When you think about the PP interval, it is nothing but the time duration between the onset of the P wave till the beginning of the next consecutive P wave. This is actually helpful in calculating the atrial rate. Normal PP interval will be up to 15 to 25 small squares. In other words, this may be up to 0.6 to 1 second. 0.6 to 1 second. Whereas normally the atrial rates will be equal to ventricular rates. But they may be different in cases of complete heart blocks. Atrial rate will be increased, but ventricular rates will be decreased. When you think about the RR interval, it is nothing but the time duration between the peak of one R wave till the peak of next consecutive R wave. Its significance is helpful in calculating the ventricular rate. As we have discussed earlier, our PP interval will be similar to RR interval. That means 15 to 25 small squares normally. That means 0.6 to 1 second normally. This is normally equal to atrial rate normally, but this may be dissociated in cases of complete heart blocks. When you think about the total ventricular activation time, or otherwise this is also being termed as intrinsic deflection, this is nothing but the time duration from the beginning of the P wave till the peak of the R wave. This is usually representing the total time duration required for the movement of electrical impulse to move from the move up to epicardial surface. Normally, it is less than 1 small square. As far as segments are concerned, PR segment, that is nothing but the distance between the end of the P wave till the beginning of the QRS complex. Whereas ST segment, that represents the distance between the end of the QRS complex till the beginning of the T wave. Whereas TP line or TP segment represents the distance between the end of the T wave till the beginning of the next P wave. Normally, all these are considered to be isoelectric lines. These are considered to be isoelectric lines. Now we will be seeing this in the coming slide as such. Now J point. When you think about the J point, it is the point between the end of the S wave till the beginning of the ST segment. So here the arrow is showing the J point. This is helpful in determining the elevation and depression of the ST segment as such. This is considered to be the PR segment, starts at the end of the P wave till the beginning of the QRS complex. Actually, it suggests the delay in the atrioventricular nerve. This is used as a baseline to evaluate the ST segment changes. Whereas ST segment, this is nothing but the line present from the end of the S wave till the beginning of the T wave. It represents the greater part of ventricular repolarization. It usually merges smoothly and imperceptibly with T wave. Whereas TP segment, which starts at the end of the T wave and ends at the beginning of the next consecutive P wave. It is an isoelectric line. As we have discussed earlier, PR segment, ST segment and TP segment, they are isoelectric lines. In a summary, the normal electrocardiogram contains waves, intervals, and segments and a J point. The waves are P wave, which represents atrial depolarization wave, QRS complex, which represents ventricular depolarization wave, T wave that represents ventricular repolarization wave, TA wave that represents atrial depolarization wave. Apart from waves, the ECG contains intervals. PR interval, that is from the 3 to 5 small squares. QRS interval, less than 3 small squares. QT interval, up to 11 small squares. Whereas the QU interval, very rarely seen. PP interval, that is the 15 to 25 small squares. RR interval, that is 15 to 25 small squares. And VAT, less than 1 small square. And J point, it is a point present between the S wave and ST segment. The take-home messages from today's discussion are: electrocardiogram, when you think about it, it is nothing but the graphical representation of electrical potentials generated by the heart, recorded by the electrodes kept at the different specified areas of the human body. This is being recorded in the electrocardiographic paper, which is nothing but a graph paper, which has the small square of 1 centimeter width and height and a large square of 5 millimeter width and height. Small square 1 mm width and height, large square 5 mm width and height. The x-axis that represents the time parameter and y-axis that represents the voltage parameter. ECG contains waves, intervals, segments, and J point. Waves, Q wave, P wave, QRS complex, T wave, sometimes U wave. Intervals, PR interval, QRS interval, QT interval, PP interval, and RR interval. And segments, PR segment, ST segment, and TP segment, as well as J point. Dear ANA community, what are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you would like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Ayurveda learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.